Hi, I'm Dr. Anthony Larson, gum recession. One question I'm often asked is, if I can solve the problem, will my gums grow back? And the truth is, usually they will not. It's helpful in knowing the causes of gum recession. Almost all of them can be addressed by talking to your dental professional and determining what you need to do differently, and then making some modifications can usually stop gum recession from happening and maintain the gums that you have. So what causes gum recession? Can be caused by a number of things: trauma, toothbrush abrasion, misaligned teeth, clenching or grinding their teeth, genetics, gum disease. If the cause of the gum recession was some sort of trauma, an acute accident, then maybe over time they will grow back. But if you have lost your gums over a matter of years, you do want to figure out what's causing that and stop the process, but they typically will not grow back. There are ways to resolve an area of missing gum tissue. A gum tissue graft is possible, but sometimes if you can figure out the cause of the problem and stop it, then you can just leave the gums where they are if your teeth are healthy. Probably the most common cause of the gum recession with my patients is toothbrush abrasion. In other words, using a toothbrush that is too stiff or too hard, or simply brushing too aggressively. The analogy I use in my office, it has to do with drawing on a painted wall. If I have a son or a grandchild that takes a crayon and draws on my wall, I can remove that crayon off the wall very quickly, but I will likely damage the paint if I do that. If I want to remove the crayon from the wall and leave the paint intact, I can't put too much pressure. I can't scrub with something too abrasive. I need to put steady pressure for a little bit longer time. So I ask my patients to brush longer, not stronger. I always recommend a soft bristle toothbrush and encourage them to not be in a big hurry and not use too much pressure. Many electric toothbrushes today do have sensors that will change color or even stop rotating if you press too hard. So that could be helpful if you're having trouble with this. So toothbrush abrasion is a very common cause of recession, and that can be stopped. Another common cause is misaligned teeth. Teeth that are crooked or tipped may lead to gum recession. And a companion to that is if someone is clenching or grinding their teeth, and those teeth perhaps are misaligned, then you will see gum recession in situations like that. Again, something that can be taken care of through some type of orthodontics or other treatment on the teeth to get them more in line. Now, I should mention that genetics is definitely a factor in gum recession. Most people genetically are prone to get some recession throughout their life, and some a lot more than others. So that's something to just talk to your dental professional about. But if you can't determine any cause for your recession, it may just be a genetic predisposition and something you have to deal with. Now, the last cause of gum recession that I want to mention today is gum disease. Gingivitis, periodontitis. If you have chronic gum disease and it's not treated, over time it will cause your gums to recede. And even if they don't appear to be receded, once they are treated and the gum disease is gone, then they will, at that time, recede. So hopefully this is helpful in knowing the causes of gum recession. Almost all of them can be addressed by talking to your dental professional and determining what you need to do differently, and then making some modifications. You can usually stop gum recession from happening and maintain the gums that you have. I want to mention also, if this gum recession that you have is leading to dentin hypersensitivity and a lot of sensitivity with your teeth, there are some things you can do to try to help that and improve it. Watch our video about dentin hypersensitivity.